The Metropolitan Medical Response System, or MMRS, was originally developed through a U.S. Department of Homeland Security grant program. The grant program provided funding for the 124 most densely populated jurisdictions to support the integration of emergency management, health, and medical systems into a coordinated response to mass casualty incidents caused by any hazard. Utilizing this federal grant program and funding provided by our local jurisdictions, the Hampton Roads MMRS was developed in 1999 by the Hampton Roads Planning District Commission. The regional MMRS program supports planning, equipping, training, and integration of public safety, hospitals, public health, and emergency management for a coordinated response to mass casualty incidents caused. The program also reduces the consequences of a mass casualty incident by augmenting existing local operational response capabilities before the incident occurs and provides regional specialized medical response capabilities during the incident. The Hampton Roads MMRS includes the cities of Chesapeake, Franklin, Hampton, Newport News, Norfolk, Poquoson, Portsmouth, Suffolk, Virginia Beach, and Williamsburg, the counties of Gloucester, Isle of Wight, James City, Southampton, Surrey, and York, and the town of Smithfield. It covers an area of 2,900 square miles and a population of approximately 1,640,000. The Planning District Commission contracts with Tidewater Emergency Medical Services Council to manage the activities of the program on a day-to-day basis, including the Hampton Roads Metropolitan Medical Strike Team. The primary mission of the Hampton Roads MMRS is to maintain and advance regional mass casualty preparedness and response capabilities with region-wide governmental operational support. Fulfillment of this mission is dependent upon the MMRS achieving several goals: refining and promoting medical response plans fully supported by all participating governmental entities that address the evolving challenges presented by natural disasters, infectious disease outbreaks, and threats of terrorism. Conducting training and realistic exercises to prepare individual medical responders and receivers for mass casualty care. Maintaining caches of appropriate medical equipment supplies and pharmaceuticals to efficiently treat mass numbers of injured and/or ill victims. Ensuring the safety of medical responders responding to disaster through availability of appropriate personal protective equipment and integrating the resources of key supporting organizations such as the Hampton Roads Hazardous Materials Teams, the Hampton Roads Incident Management Team, the Eastern Virginia Healthcare Coalition, and the Hampton Roads District Offices of the Virginia Department of Health. The Hampton Roads Metropolitan Medical Strike Team, or MMST, is a component of the Hampton Roads Emergency Response System and is staffed from the 213-member call group, including fire and rescue personnel, paramedics, and EMTs, physicians, and physician extenders, and law enforcement personnel.
Well, the founding of the team was a collaborative effort between many of the localities, hospitals, physicians, and other health department and other entities across the entire Hampton Roads region to better prepare us to be able to respond to incidents involving multiple or especially mass casualty patients that exceed the capabilities of any one or two localities.
The MMRS for Hampton Roads is something that, for me as a fire chief, gives me a level of comfort, because I think that we all recognize that any one of our jurisdictions could be overwhelmed with the need for patient care, the need for potential patient care that may be absent a quick transport as what normally would happen. And so the ability to have the MMRS team respond and knowing the team makeup and the fact that the people have certain levels of certification, we know this in advance whenever we ask for the team, so we know what we're getting.
In our city of Virginia Beach, our opportunity to use MMRS could be a reality. We have, throughout the year, certainly we have a large populace, and then also we have many, many special events, over 600 a year. Some draw from 50 citizens to over thousands. So at any given time, there could be a need, when we talk about mass casualty incidents, I think that's when MMRS would fit into our response matrix.
York County being the place where America's freedom was won, we constantly have different historical groups and other entities that want to come here to celebrate the significance of our part in history. We have various dignitaries come in, from the President of the United States to dignitaries from other countries come to Yorktown, and any one of those types of events is certainly an area of potential terrorism or just a mass gathering event with multiple thousands of people in a small area. And to be able to pre-deploy the MMST to handle a potential need for emergency medical services or any other kind of healthcare needs in the confined area of Yorktown or other places in our jurisdiction could be a valuable asset, and one that we couldn't handle ourselves without the assistance of MMST.
The strike team is trained and equipped to provide operational assistance and expertise to incident commanders regarding the medical effects of a mass casualty incident or any other incident caused by chemical, biological, radiological, nuclear, explosive, or weather-related emergencies that would place demands on the region's medical or public health resource systems. The MMST can operate self-sufficient for up to 96 hours with little or no logistical support from the requesting jurisdiction. This time frame allows state and federal assets time to mobilize and integrate into independent operations if needed. As needs or threat levels change, the composition, organization, and mission of the medical strike team may change to meet the threat or need through NIMS-typed operational levels.
From my perspective, the item that makes this program special is that you have people that are well-trained professionals that are practicing EMS service delivery in their own home jurisdictions. And when this team is called upon to go to a disaster site, those individuals that are well-trained and practicing every day bring that skill set to bear wherever the disaster is.
As a battalion chief with Norfolk Fire Rescue and also being a strike team leader with the MMST, it's actually kind of comforting knowing that if I have a mass casualty incident or an incident that's going to require mass decon, that I have that resource available to me. One of the things as being a strike team leader, I know how that team integrates. So when I'm functioning in the role of an incident commander, I can pull on a resource that I already know and know the capabilities of the resource, know the number of people I'm going to be bringing to bear on the incident, and it's a good benefit to have both sides of that to be able to work from.
Based on regional threat assessments and capability gaps, the Hampton Roads Metropolitan Medical Strike Team focused its mission on the following 7 capabilities. Mass casualty management and patient movement and coordination, which provides for the coordinated transportation and movement of patients during an incident. This involves documenting and tracking patient movement coordination from the initial contact to their arrival in the emergency room. Warm zone triage, decontamination, monitoring and detection during any chemical, biological, or radiological exposure. Decontamination of victims and emergency response personnel prevents further exposure outside the incident area. Rehabilitation and medical force protection of responders during operations of any large complex incidents. This ensures the responders do not become victims themselves by providing rehabilitation services such as oral hydration, rest and recovery, and meeting nutritional needs. Additionally, medical monitoring is performed to ensure responder health and safety. Medical consultation and coordination provides subject matter experts as consultants in the operation of a medical branch. For instance, team physicians are available to provide direction for appropriate emergency medical care to victims and responders. Chemical weapon and toxic industrial chemical antidote administration. The medical strike team maintains a pharmaceutical cache of nerve antidotes, antibiotics, and other medications that are immediately available to all EMS agencies, hospitals, and public health departments in the Hampton Roads area. Many of these medications are not available in standard pharmaceutical drug boxes. The team is capable of providing functional medical needs sheltering assistance in emergency shelters. The team is equipped to provide mass fatality assistance when an incident causes loss of life and can assist with protecting the integrity of the remains. The Hampton Roads Metropolitan Medical Strike Team can deploy in one of 4 operational staffing levels to meet the threat or need of the event. The strike team leader will contact the requesting agency to determine the needs of the incident commander. This will allow the strike team leader to determine the appropriate level of response and expertise needed to carry out the mission. The HRMMST Type 4 operational level represents a minimum of 8 personnel that are specifically trained in chemical, biological, radiological, nuclear, and explosive response that can be deployed to help a local jurisdiction manage the impact of these types of events that generates multiple casualties. These subject matter experts would be used to assist the existing incident command structure with consequence management, or can be used to fill the vacancies within the existing medical branch of the command structure to assist with incident management. The HRMMST Type 3 operational level represents a minimum of 14 personnel to provide resources that support an incident such as a large-scale rehabilitation operation. Personnel assigned represent logistical and medical staff to perform responder rehabilitation for extended operational periods. The personnel can set up a rehabilitation facility that is climate-controlled and provide medical monitoring of responder personnel. The HRMMST Type 2 operational level represents a minimum of 26 CBRNE trained personnel. These specialists respond with equipment to assist the jurisdiction with patient care or decontamination at man-made or natural disaster events that result in more victims than local resources can manage independently. The HRMMST Type 1 operational level represents a minimum of 44 CBRNE trained personnel, including equipment and supplies, to function for up to 96 hours at incidents involving weapons of mass destruction, accidental releases, or catastrophes resulting in more casualties than local resources can effectively handle. The Hampton Roads Metropolitan Medical Strike Team has 2 identical equipment caches, one on the south side stored and maintained by Norfolk Fire Rescue, and one on the peninsula stored and maintained by York County Department of Fire and Life Safety. Each equipment cache contains all of the equipment, pharmaceuticals, and supplies needed for initial medical strike team operations. The closest and most accessible cache will be deployed to the incident. Both jurisdictions' agencies have signed agreements in which they will use the equipment, pharmaceuticals, and supplies to augment its emergency medical response resources during a mass casualty, disaster, or terrorism event as part of the HRMMRS. Honor mutual aid requests from other Hampton Roads jurisdictions and organizations for such equipment, pharmaceuticals, and supplies during mass casualty events that exceed the resources of the requesting party. Provide proper storage and reasonable maintenance, repair, and use to maintain operational condition of the equipment, pharmaceuticals, and supplies. Provide 24 hours day response capability, subject to availability, to deploy the equipment, pharmaceuticals, and supplies upon activation of the medical strike team. The Hampton Roads Metropolitan Medical Strike Team is activated with a phone call from a local jurisdiction's Emergency Communications Center to the York County Emergency Communications 911 Center at 757-890-3621. In the event the notification to the York County ECC is not possible, the Norfolk Emergency Communications Center, acting as a backup, should be notified by calling 757-441-5610. The HRMMST can be activated by the local public safety chief officers, the local incident commanders, the local emergency management coordinators, other organizations and agencies via their respective jurisdictions' emergency communications center.
All 213 members would receive an instant notification advising them of an incident, where it was, what was involved, and what was the request from the local incident commander.
Well, I see the team members as assisting emergency management in helping at the field level, but also at the Emergency Operations Center level, where they can help coordinate and help emergency management make key critical decisions that will support the field operations should we have a mass casualty event within the city of Hampton.
The HRMMST has been deployed several times for pre-planned events and potential multiple casualty incidents, including the governor's inauguration, 2 Langley air shows, the Virginia Beach Patriotic Festival, the Suffolk Tornado, and Bill's Flea Market Fire. An after-action report is completed following each deployment and a plan developed to address any areas for improvement. The Hampton Roads Metropolitan Medical Strike Team Memorandum of Understanding addresses the sponsorship, response, staffing, and training requirements for localities and civilian agencies supporting Hampton Roads Metropolitan Medical Strike Team members under the provisions of the Hampton Roads Metropolitan Medical Response System Mutual Aid Agreement. Strike Team members requested to respond to a Hampton Roads Metropolitan Medical Response System activation or participate in training and regional exercises are covered under the individual member sponsoring jurisdictions or agencies' insurance and compensation policies and plans, including, but not limited to, health, liability, and workers' compensation benefits.
Well, in my department, you get trained up to an intermediate level. So I would go out and I would say, look, you want to be a part of this team. I understand that you don't know what it's like to, let's say, put up a Western shelter tent. You don't understand what it's like to put on these nice little suits and get all hot and sweaty. But think of the other aspect of it. You get to combine with other cities. You are building a regional team, and you're building networks, and you're building relationships with other people from different jurisdictions. That in itself is a big plus because you work in Newport News. How often from the city of Newport News do you get to train with Norfolk, Hampton, Portsmouth, York County? I mean, those are relationships and things that you build that you would never be able to build just as a Newport News Fire Department personnel.
Participating jurisdictions and agencies agree that HRMMRS team members are available to respond to an MMRS activation anywhere in Hampton Roads, both on and off duty, unless to do so would cause an undue hardship on the affected locality or agency.
So if there's a regional team that's available to service the needs of the southeastern Virginia corridor, even larger Virginia corridor, if, God forbid, a catastrophic event should occur, then I certainly would like to be in a position to share my time, my expertise, my talent with that group of amazing people to help mitigate the situation.
It's very important to me that I give back to my community, and so by joining the team I was able to help give back to the community by helping with disasters or things that happen in our area and take care of our people.
Strike team members respond at no cost to the requesting locality, provided they are responding to a properly executed MMRS incident and are part of the strike team on call. Becoming a member of the Hampton Roads Metropolitan Medical Strike Team is dependent on their affiliated jurisdiction or agency. Many departments offer its members the option to join on a voluntary basis, while other departments require the members assigned to specific stations to be associated as a mandatory requirement. Strike Team member recruitment and selections are conducted by the HRMMRS Leadership Group. Recruitment for new members occurs when a vacancy exists and/or insufficient pool of applicants is available for consideration.
So since I've joined the strike team, I've been fortunate that I've had the opportunity to not only attend the quarterly drills to learn the equipment and the procedures that we use, but I've also had the opportunity to attend additional incident command schools such as ICS 300 and ICS 400. Also, I've taken the EMS functions and ICS course, which allows me to better understand the roles that the EMS provider would have in such as a mass destruction type of a situation. I've also attended the chemical, biological, radiological, nuclear, and explosive or seaborne course so I could better understand the things that I would need to do to care for patients that might be involved in that situation.
Pretty much, I had heard a lot of good things from guys in the fire department. They said that, this is one of the teams that you really want to be on because you get to do a lot of cool things. You get a lot of training that the fire department really doesn't provide unless you are on the hazmat team. You just really get a whole lot of good training that, goes hand in hand with your job.
As a new member, the initial training focus is pre-deployment training. This training must be completed within 6 months of appointment or availability of training and consists of Basic Incident Command, IS 100 and 200, National Incident Management System, IS 700, Emergency Response to Terrorism Awareness, Mass Casualty Incident Management Awareness, Hazardous Materials Awareness, and Strike Team Orientation. Upon completion of the pre-deployment training, members are issued strike team gear which includes uniforms, chemical protective suits, and personal protective equipment. Members are then eligible to participate in core component training, which prepares each team member to operate their team position during incidents.
Being a member of the MMST has given me the opportunity to work with people across the region, not only just in fire and EMS, but police and public health. It's really opened up a spectrum to when emergencies really do happen, we already have that opportunity, we know each other, and we're able to make those connections very quickly. It also gives us the opportunity to work collaboratively together, even in non-emergency situations, as we develop plans for working with those situations where we may face in the future.
The minimum participation level for HRMMRS team members is defined as participation in the mandatory annual maintenance training and a minimum of 50% of the bi-monthly component trainings conducted the third Thursday of February, April, June, August, and October. A member in good standing is defined as a member that has met the minimum participation requirements. A probationary is defined as a member that fails to meet the minimum participation requirements. That member will be placed on a probationary status for a period of 1 year. The expectation is that member would increase their activity level to meet the minimum participation requirements. An inactive member is defined as a member that has not participated in any training activities for 1 year. Inactive members will be removed from the HRMMST. Members in specialized positions, for example physicians, physician extenders, and law enforcement, and members that are in limited duty status will be granted exceptions to the minimum participation level. The Hampton Roads MMRS was originally funded through a U.S. Department of Health and Human Services contract from 1999 through 2003. Beginning in 2004, the program was funded from the U.S. Department of Homeland Security Grant Program. Federal funding for MMRS programs nationwide ended on August 31, 2014. During its 15 years, the MMRS program was the only federal grant program that supported multidisciplinary mass casualty response planning at the local and regional level. In addition to federal grants and contracts, the 17 Hampton Roads jurisdictions have and continue to support the MMRS through local assessments. This support, known as sustainment funding, continues to enhance and sustain 4 core capabilities. Mass casualty incident response preparedness supports continued mass casualty training and disaster exercise support. Hampton Roads Metropolitan Medical Strike Team supports the response capability and training of the 213-member strike team. Mass casualty incident and disaster response equipment and supplies supports the replacement of expired medical supplies in the DMSUs, SSUs, and MCETUs. Pharmaceutical caches, continued maintenance of pharmaceutical caches of nerve agent antidotes, antibiotics, and hazardous materials antidotes that are immediately available throughout the Hampton Roads region. During its growth and development, the Hampton Roads MMRS program used various federal and local funding sources to purchase personal protective equipment for public safety agencies, hospitals, public health, and medical examiner personnel, decontamination systems for 15 hospitals, 11 disaster medical support units, 10 mass casualty evacuation and transport units, and 13 shelter support units. It supports ongoing training and exercises in mass casualty incidents, disaster response, and incident management. The Hampton Roads MMRS program will apply for any state and federal grants that support its core capabilities to help offset or augment sustainment funding provided by the Hampton Roads localities. Examples include Homeland Security grant programs, the State Homeland Security Program, the Urban Areas Security Initiative, the Hospital Preparedness Program, and the Virginia Financial Assistance for Emergency Medical Services Grants Program, known as the Rescue Squad Assistance Fund Program. Since 1999 to the present day and into the future, the Hampton Roads Metropolitan Medical Response System helps ensure people are trained and resources are in place to provide a coordinated and robust mass casualty response to natural and man-made disasters. All responders should understand how to use these mass casualty resources when disaster strikes. All public safety leaders and incident commanders should know to incorporate these resources in mass casualty planning and how to activate the Metropolitan Medical Strike Team. Should you have any questions about the Hampton Roads MMRS program or interest in serving as a member of the Metropolitan Medical Strike Team, please contact us at 757-963-0632 or email HRMMRS@vaems.org. For additional information, please visit our website at www.hrmmrs.org.